Issues. Let me come to Dr. Habeebu. Can a man be down with breast cancer?
Men can be down with breast cancer. Actually, according to statistics, 1 out of every 100 patients that have breast cancer is a man, while 99 are women. So men are down with breast cancer.
So what are those signs such men should also look out for?
Well, the similar sign, breast cancer in men and women are the same. Only that for men, the breasts are rudimentary, so it's easy to see. So what we look for is lump in the breast, abnormal discharge from the nipple, usually bloody discharge, the abnormal, what looks like a scar or what looks like eczema on the skin of the breast. That's erythema, eczema on the skin of the breast, and chronic ulcer. That is a wound that refuses to heal around the breast. Usually, if there's a breast cancer, after a while, you also see a lump at the armpit, at the axilla. That's what we call lymphadenoma, lymph nodes, at the axilla. And usually, if still you do not attend to this, it starts to spread because cancer can spread. So it can spread to the lungs, and you can see the patient presenting with cough. It can spread to the bones and cause what we call pathological fracture. And the patient may start losing weight, because the cancer cells, they can feed on the, interfere with metabolism and cause loss of weight. And this is almost similar with female, only that for female, the breasts usually are well developed, so they can hide the lump. So you need to be concerted. You need to pay concerted effort to, do self-breast examination. That's the female examining her breast regularly, maybe in 6 months or a year, if there's nothing, after the first few examinations. Then what we also call clinical breast examination, the patient goes to see either a doctor or a nurse who is well trained to examine the breast. Then also a woman, apart from self-breast examination and clinical breast examination, you're also required to do breast ultrasound scan regularly. That is using a scan to check the breast, because what your hand cannot pick, a scan may be able to pick. And for women that are more than 45 years old, they also need to do mammogram, because the breast of women that are much advanced in age is usually less dense than those that are younger. So mammogram will pick what ultrasound scan does not pick at that age. Doctor. And at times you may need to do the two. And screening is very important because it picks the early signs of breast cancer. And by the time a patient is having symptoms, that's having pain or having obvious swelling that is marked, it might already be a higher stage. It might be becoming late. It might be advanced. So it's very important to have screening even before you start having signs and symptoms of breast cancer.
Okay, Dr. Habeebu, we've seen my colleague read out some statistics about the high number of cancer incidences in the previous years, but what is the cause of cancer? What are the causes of breast cancer and different kinds of cancers? And if maybe you are diagnosed with breast cancer, what are the next steps that you can take?
The cause of breast cancer is multifactorial. There are many factors that can result to breast cancer, but largely they can be divided into inherent factors or genetic factors and acquired factors. It's the acquired factors that you can work on more, but the inherent factor with the genetic factor, you can do gene typing. You can check your gene to see if you have the familiar traits, which usually is BRCA1, BRCA2. This usually will account for about 20% or less of breast cancer. And those who have this gene, the breast cancer will run in their family. You see many of their females having breast cancer, like the mother, like the grandmother, aunties, cousins, and so on, sisters, However, the acquired factors, one important factor is also sedentary lifestyle. Then how early the person starts menstruating. Those who start menstruating, what we call menarche, at very early age. And then they also have delay menopause. They start menstruating very late age, and also probably do not have children. We say they are nulliparous, or they give birth, they do not breastfeed. All this will increase the chance of having breast cancer. Then exposure to ionizing radiation may also increase it. Those who have breast lump, who are hitherto not malignant, are also predisposed to having breast cancer. So if you have breast lump, but it's not cancer, it may predispose you to.
It's a fine place. It's a fine place to live it. Oncologist and Chief Clinical Coordinator, Luth Cancer Center, Dr. Mohammed Habeebu. Many thanks for joining us on the program this morning.
Thank you for having me.
Thank you.
Thank you.